everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Atenolol. Its brand name is Tenormin. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Atenolol is a synthetic beta-1 selective adrenoreceptor blocking agent. At higher doses, it also blocks beta-2 adrenoreceptors in certain areas. In terms of indications for use, Atenolol is indicated to be used in the treatment of hypertension or high blood pressure. We see it used in angina pectoris when it's chronic, that is chronic chest pain. And we can also see it used following a myocardial infarction or a heart attack. And before somebody was to use Atenolol, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. If somebody had a hypersensitivity to Atenolol or any other component of the product, they would not be able to use this medication. We also would not be able to give this medication to individuals who have cardiogenic shock. Patients with overt cardiac failure cannot use Atenolol, and neither can patients who have sinus bradycardia. Finally, for contraindications, Atenolol cannot be used in patients who have second or third degree heart block. Now, in terms of precautions, it's important to note with Atenolol, there is a risk of cardiac failure, and this can happen in individuals who actually don't have a history of cardiac failure. If patients with heart failure use Atenolol, there is a chance that they may worsen their heart failure. Peripheral vascular disease may be aggravated with the use of Atenolol, and this medication has the ability to sometimes mask the symptoms of hypoglycemia seen in diabetic patients. An example of this would be tachycardia, or a rapid heart rate. Dose adjustments may have to be made if Atenolol is given to individuals who have severe renal impairment. And lastly, we generally try to avoid giving Atenolol to individuals who have bronchospastic diseases. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, they can expect to receive their dose orally, as Atenolol is available as an oral tablet as well as an oral powder for solution. If somebody is using Atenolol to treat their hypertension or high blood pressure, they can start off with an initial dose of 50 milligrams given once daily. After about 1 to 2 weeks, if the patient doesn't have an adequate response, they can increase the dose to 100 milligrams. The guideline dosage for Atenolol in hypertension is anywhere from 25 to 100 milligrams given daily in 1 or 2 divided doses. If somebody is using Atenolol to treat chronic chest pain, they can also start off with a dose of 50 milligrams taken once daily. However, in this setting, after 1 week, they can increase the dose to 100 milligrams if needed. Some patients may need to increase the dose further, and the maximum dose in this setting would be 200 milligrams daily. So as with all medications, there are some side effects or adverse reactions that patients may experience while using Atenolol, so I'll go over some of those here now. Bradyarrhythmias may happen in up to 18% of patients. About 12% of patients may feel cold extremities. Hypotension or low blood pressure can happen anywhere from 4 all the way up to 25% of the time. Dizziness comes in at a rate of 13%. And surprisingly, depression comes in at a rate of up to 12%. Up to 26% of patients may have a feeling of fatigue. Now, some more rare but serious side effects would be the development or aggravation of heart failure, also myocardial infarction or heart attack. Some patients may experience anaphylaxis, and others may develop a pulmonary embolism. And lastly, some patients, especially if they stop the medication abruptly, may experience withdrawal symptoms. That's all we're going to talk about today with Atenolol. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.